Prostate cancer often develops slowly and may not show significant symptoms in its early stages, but there are certain signs that might indicate its presence. Prostate cancer is one of the most common cancers in men and the second leading cause of cancer deaths among men. While it can be life-threatening, early detection significantly improves the chances of survival. In fact, when prostate cancer is detected early, survival rates are extremely high. Regular screening tests, such as the prostate-specific antigen blood test and digital rectal exam, are critical in identifying the disease at an early stage. Monitoring symptoms like difficulty urinating or blood in the urine is also important for timely intervention. Prostate cancer develops in the prostate, a small gland in men located below the bladder and in front of the rectum. The prostate plays a vital role in producing fluid that nourishes and transports sperm. The disease can remain localized to the prostate or spread to nearby tissues and other parts of the body, such as bones and lymph nodes. Understanding the function and location of the prostate helps in recognizing the areas affected by the cancer and the symptoms that may arise. Several risk factors contribute to the development of prostate cancer. Age is the most significant factor, with risk increasing significantly after age 50. A family history of prostate cancer doubles the likelihood of developing the disease, especially if close relatives were affected. Genetic mutations further elevate the risk. Ethnicity also plays a role, as prostate cancer is more common and tends to be more aggressive in African American men. Lifestyle factors, such as a diet high in red and processed meats, low intake of fruits and vegetables, obesity, and lack of physical activity, can also contribute. Other risk factors include exposure to certain chemicals and smoking, which may increase the risk of aggressive forms of prostate cancer. Here are 7 symptoms of prostate cancer you should be aware of. One of the more common indicators of prostate cancer is difficulty urinating. This may manifest as trouble initiating or stopping the flow of urine, a weak or interrupted stream, or a persistent sensation that the bladder hasn't been fully emptied after urination. Men with these symptoms often find themselves straining to urinate or experiencing a prolonged process to complete urination. Additionally, some may notice a frequent or urgent need to urinate, particularly at night, a condition known as nocturia. This frequent nighttime urination can significantly disrupt sleep, leading to fatigue and affecting overall quality of life. In more advanced cases of prostate cancer, men may experience painful urination or a burning sensation during urination, a condition known as dysuria. This discomfort arises because the growing tumor can press against the urethra, the tube that carries urine from the bladder out of the body, or invade surrounding tissues, leading to irritation and inflammation. The pain or burning sensation can be constant or may occur intermittently, and it often raises concerns about potential infections or inflammatory conditions. These symptoms are not exclusive to prostate cancer and can also be associated with urinary tract infections or prostatitis, inflammation of the prostate, but they warrant prompt medical evaluation to determine the underlying cause. Blood in the urine, or hematuria, is another possible symptom in more advanced stages of prostate cancer, though it is less common. Hematuria can manifest as pink, red, or cola-colored urine, indicating the presence of red blood cells. This occurs when cancer cells invade the urinary tract, damaging blood vessels and allowing blood to leak into the urine. Even a small amount of blood that is not visible to the naked eye can be detected through laboratory tests and should be taken seriously. The presence of blood in the urine is a significant warning sign that should never be ignored, as it may indicate not only prostate cancer, but also other serious conditions like bladder or kidney cancer, kidney stones, or infections. If you are finding this information helpful, please like and subscribe. Pain or discomfort in the pelvic area, lower back, or hips can be a significant warning sign of advanced prostate cancer, particularly when the disease begins to spread beyond the prostate gland. These aches or pains may be dull, persistent, or intermittent, and are often initially attributed to common issues such as muscle strain, arthritis, or general aging. However, such discomfort could signal that cancerous cells have invaded nearby tissues or bones, a condition known as metastasis. The pelvic bones and lower spine are common sites for prostate cancer metastasis due to their close proximity to the prostate and the high density of blood and lymphatic vessels in the area, which can facilitate the spread of cancer. As the cancer advances, the pain may intensify and become more localized, making activities like walking, bending, or sitting increasingly difficult. In some cases, the pain may radiate down the legs, mimicking sciatica if the growing tumor presses on surrounding nerves. Additionally, metastatic cancer in the bones can lead to structural weakness, increasing the risk of fractures even from minor injuries. This is particularly concerning in weight-bearing areas like the hips and lower back, where fractures can have a significant impact on mobility and quality of life. It's important to note that pain in these areas doesn't always indicate cancer and can result from other conditions such as herniated discs, osteoporosis, or injury. However, persistent or worsening pain, especially when accompanied by other symptoms like difficulty urinating, blood in the urine, or unexplained weight loss, should prompt a thorough medical evaluation. Sexual health changes, such as erectile dysfunction, may serve as a warning sign of prostate cancer, particularly when these changes occur suddenly or without an identifiable cause. While erectile dysfunction can have many origins, ranging from psychological factors to cardiovascular issues, its unexpected onset may indicate that the cancer is interfering with the nerves, blood vessels, or hormonal balance required for achieving and maintaining an erection. The prostate gland is located near crucial nerves and tissues involved in sexual function, and as cancer grows or spreads, it may disrupt these delicate systems, leading to difficulties in sexual performance. Another potential symptom is painful ejaculation, which can signal irritation or inflammation within the prostate gland. This discomfort during ejaculation may be accompanied by other urinary symptoms, such as pain or burning sensations, suggesting that the cancer is affecting both the gland and surrounding tissues. While painful ejaculation is not as commonly recognized as a symptom of prostate cancer, it can cause significant distress and impact a man's overall quality of life, warranting medical evaluation. In some cases, swelling or discomfort in the testicles may occur, although this is less common. This symptom can arise if the cancer spreads to nearby lymph nodes or structures within the pelvis, causing localized pressure or fluid buildup. Men may notice a feeling of heaviness, tenderness, or an unusual lump in the testicular area, which could be a sign of metastatic cancer or another serious condition. Changes in sexual health, such as those mentioned above, should not be ignored or dismissed as merely age-related. While they can result from a variety of non-cancerous conditions, their presence, particularly in conjunction with other symptoms like urinary difficulties or pelvic pain, should prompt a thorough medical assessment. Fatigue and unexplained weight loss can be significant indicators of more advanced stages of prostate cancer. These symptoms often arise as the body's energy reserves and nutrients are consumed by the growing cancer. Fatigue in this context is not the typical tiredness experienced after physical activity or a lack of sleep. Instead, it is a profound and persistent exhaustion that doesn't improve with rest. This type of fatigue occurs because the cancer competes with the body for resources, diverting energy away from normal physiological functions to fuel its growth. Additionally, the body may produce inflammatory chemicals in response to the cancer, which can further exacerbate feelings of weakness and lethargy. Unexplained weight loss is another common sign of advanced cancer and may occur even without changes in diet or exercise habits. This weight loss is often referred to as cancer cachexia, a condition characterized by the breakdown of muscle and fat tissue. Cachexia can result from the cancer altering the body's metabolism, making it harder to maintain weight despite adequate calorie intake. The metabolic changes can cause a loss of appetite, making it challenging for individuals to consume enough food to sustain their weight. As a result, the individual may appear visibly thinner, with a noticeable reduction in muscle mass and overall physical strength. These symptoms can be particularly concerning because they indicate that the cancer is placing a systemic burden on the body, potentially spreading to other organs or tissues. Fatigue and weight loss are not exclusive to prostate cancer and can occur with other illnesses, such as infections, metabolic disorders, or other forms of cancer. However, when combined with other prostate cancer-related symptoms like urinary difficulties, pelvic pain, or erectile dysfunction, they become more suggestive of an advanced stage of the disease. Some men might experience changes in bowel habits, such as constipation, difficulty passing stool, or a sensation of incomplete evacuation. These symptoms can occur if an enlarged prostate, whether due to cancer or benign prostatic hyperplasia, presses against the rectum. The close anatomical relationship between the prostate and the rectum means that a growing tumor can exert pressure, narrowing the space available for stool to pass and making bowel movements more difficult. In severe cases, this pressure may cause discomfort, pain during bowel movements, or even changes in stool shape, such as thinner or ribbon-like stools. Although these symptoms are not exclusive to prostate cancer and may be linked to other conditions like dietary issues or irritable bowel syndrome, they warrant medical evaluation if persistent. In more advanced stages of prostate cancer, swelling of the lymph nodes in the groin may also occur, although this is less common. The lymphatic system is a key part of the body's immune defense, and lymph nodes act as filters for abnormal cells, including cancer cells. When prostate cancer spreads, it can travel through the lymphatic vessels and accumulate in nearby lymph nodes, leading to swelling or tenderness in the groin area. This swelling might be accompanied by a feeling of heaviness or discomfort, and in some cases, the swollen nodes may be visibly enlarged or detectable as lumps under the skin. In conclusion, the symptoms of prostate cancer can vary widely, ranging from subtle changes in urinary and sexual health to more noticeable signs such as pelvic pain, fatigue, unexplained weight loss, or bowel habit changes. While many of these symptoms can be attributed to non-cancerous conditions, such as benign prostatic hyperplasia or infections, their persistence or sudden onset warrants medical attention. Recognizing the warning signs, such as difficulty urinating, painful ejaculation, blood in the urine, or swelling in the lymph nodes, can be crucial for early diagnosis and treatment. Advanced symptoms, such as profound fatigue, significant weight loss, and discomfort in the lower back, pelvis, or hips, may indicate that the cancer has progressed or metastasized. Timely medical evaluation and routine screenings, such as prostate-specific antigen blood tests and digital rectal exams, are essential tools for detecting prostate cancer early, when treatment is most effective. By staying vigilant about changes in health and addressing symptoms promptly, men can improve their chances of successful treatment and maintain a better quality of life. If you found this information helpful, please like and subscribe. Thank you for watching. See you in the next video.